Without further ado, let's move into the agencies, and we'll start with HHS.
And with an overall discretionary budget this year of a little bit over $80 billion and a requested IT budget of $7.29 billion, HHS is the largest non-defense agency in the government, and that's not all that surprising when you consider the breadth of the mission here. So what we're showing here is that IT budget broken out in a number of different ways. So the chart on the left is a 3-year depiction of the overall IT budget split up into development, modernization, and enhancement, or DME funding, and steady state, or SS funding. Now, Tim went through those definitions for the DoD briefing, but for those of you who are unfamiliar with the terms, think of DME as CapEx spending. So it's new money that they're using to buy new products and services or set up new systems. And steady state is more OpEx, or operations and maintenance funding. Now, you'll notice that the majority of the budget up here is steady state, although the department did still request $811 million in DME, so there are definitely still some major developmental activities going on here. It's important to keep in mind at this point that the divide between DME and steady state is not necessarily set in stone. Now, we've recently been noticing many agencies turning to steady state funds that would otherwise have been used on infrastructure maintenance and instead using them for tech refreshes or making incremental improvements to systems that they already have. Now, basically, if you can demonstrate good return on investment and lower total cost of ownership, and you're going to hear both of us say those phrases a lot, agencies can and they will dip into their steady state buckets to buy new things. We're also seeing things like software as a service and other subscription-based business models having some success selling into steady state dollars. Now, moving on to the sub-agency breakdown on the right, you'll notice that the lion's share of HHS's IT budget is split between the Centers for Medicare and Medicaid Services, or CMS, the National Institutes of Health, or NIH, and the Administration for Children and Families, or ACF. And CMS is the largest one there with 58% of HHS's total IT budget. And we don't show the Office of the Secretary up here. They really just missed the cut. But that is another group to look out for in terms of IT spending, both now and particularly moving into the future. Health and Human Services is still headed by Kathleen Sebelius, and it's divided into the staff offices, which you can see up here highlighted in blue, and the operating divisions, or OpDivs, at the bottom of the screen there. Now, that's essentially the division between headquarters functions and the sub-agencies who are largely responsible for carrying out the various aspects of the mission. Most of what happens at the staff office level is policy, it's regulatory, and so generally speaking, you aren't going to see that many sales opportunities at that level, but you do still want to pay attention to the folks up there because the policies and the regulations they set are really driving purchasing decisions and requirements at the OpDiv level. And from that perspective, the two groups to really focus on here are the Office of the National Coordinator for Health IT, or ONC, and obviously the Office of the Chief Information Officer, who reports up to the Assistant Secretary for Administration. Now, as for the OpDivs, I mentioned earlier that the big three are CMS, NIH, and ACF. Two others to pay attention to with substantial budgets here are the Centers for Disease Control and Prevention, or CDC, and the Food and Drug Administration, or FDA. We're going to discuss CMS a little bit later, and you'll find organizational information on all the others I just mentioned in your territory planners.
So this is a breakdown of the department's CIO office. That's a position that's currently held by Frank Bateman. Some of you may be familiar with him. He was previously at SSA. Now, traditionally, this group has served mostly in an oversight role, and they're responsible for things like HHS eGov initiatives, IT investment analysis, developing and coordinating IRM policies, and performance management. However, we are actually seeing some movement here that matches up with a larger trend across government. So we're starting to see some centralization of IT management function actually up here at the department level. Now, stretched budgets have agencies looking for ways that they can consolidate management and drive down costs. So Bateman is actually trying to get a little bit better of a picture of the overall HHS IT portfolio. Now, he also has another goal. He sort of views the headquarters CIO shop as a little bit of a lab of sorts. And the idea is to try things out at headquarters level, and if they're successful, put out best practices and lessons learned, and actually distribute those systems or technologies that get developed up there to the wider HHS enterprise. So the takeaway here is that the OCIO shop is about to get a lot more interesting for COTS vendors. Now, assuming the CIO's vision is actually borne out, Success stories at this level are going to become critical for enterprise-wide sales, and be sure to start fostering strategic relationships up here at the CIO level. Now, another trend that we're seeing mirrored in HHS is the move towards shared services. The department actually recently looked at updating its HR systems across the enterprise, and they came to the conclusion that actually moving the management of their HR systems over to Agricultural's National Finance Center was the most cost-effective way of getting their new systems up to date. So that migration has already begun, and although it's still in somewhat of a project design phase, OMB has approved that move, and the timeline for this HR migration to be complete is about February 2015.
We mentioned CMS earlier as the largest of the optives in terms of IT budget, so I wanted to take a quick look here, look exactly where that money is divided up. So highlighted in green up here are the major CMS centers from an IT standpoint. The highest profile group right now is the Center for Consumer Information and Insurance Oversight, or CCIIO, which is a mouthful, and they're also responsible for designing and operating the infrastructure supporting the Affordable Care Act exchanges. That office has been led by Gary Cohen since August of 2012. Another group to look out for is the Office of Information Systems, which is headed by Tony Trenkel, and that resides under operations. They handle more of the conventional infrastructure and application management functions for CMS. They're also the people to talk to for cybersecurity and general business applications.
So here's the first example of something we'll do for all the agencies we've discussed today. We also break this out in the planner agencies, but this is a breakdown of the top IT contractors and contracts within this space. You know, these, just the caveat here, although we're showing you FY13 numbers, these are not complete FY13 numbers. Luckily, we don't suffer from the 90-day reporting delay that DoD does, so these are fairly up-to-date information, but we're probably still missing some of those late September sales, so these numbers could very well jump before the, once all the reporting is finally in. You'll see a lot of the usual suspects here, Lockheed Martin, General Dynamics, CGI, which did healthcare.gov. As you know, that was kind of a rocky rollout, and there's some scrutiny and oversight now, but they're really preparing for a tech surge, and we'll actually talk about the investment that covers healthcare.gov in a couple of slides. You can also look here. There are GSA Schedule 70 that they look to use, as well as SUP 4. immixGroup has a strong presence on both of those. But they also have some specific vehicles that are used by the operating divisions as well. So CMS handles a lot of its development activities through the Enterprise Systems Development Contract. There's also a lot of business on a lot of NIH GWACs, CIO SP2, CIO SP3, and ECS 3. And that's managed by NIH's NITAC group. In, I think, was it March of this year? It was pretty early on. We actually had a draft RFP for CIOCS. That's the follow-on to ECS3. That's currently, that draft RFP is out, although the comments period has closed. We're going to hope that we're going to have an RFP sometime in the near future out for that, but who knows with the with all the troubles that they've been having with funding.
So, unsurprisingly, the most visible factor that drove HHS IT procurement last year and really moving into this year is the implementation of the Affordable Care Act. You may also know that as Obamacare. Now, this was a multi-agency effort, so IRS was also pretty heavily involved here, but CMS really took the lead, as I mentioned earlier, on designing the infrastructure around the exchanges, as well as building out a lot of back-end systems on their end to handle the influx of all the data that was coming in. Now, we all know that those exchanges did not have the smoothest rollout in the world, but they are here to stay, and they bring all kinds of data management, storage, and analytical requirements with them. There's also obviously healthy security requirements built in with all that data, so expect HHS and particularly CMS to bulk up on data security and encryption capabilities, as well as some network security, IDS, IPS, and incident detection and remediation tools for the data centers. Now, there are a few other things up here that bear mentioning, not least the new importance of cloud computing to the HHS enterprise. Now, by some estimates, the agency is slated to bring its cloud addressable funding up to $3 billion by by the end of FY14, which is obviously a huge number. It's important to take that with a grain of salt. That comes from some analysis of their budget documents, and it includes total spending on all of their major infrastructure investments. Obviously, not all of that is going to go to cloud infrastructure, but the point here is the department really does recognize the necessity of moving off of its very expensive and in most cases pretty outdated infrastructure. Frank Bateman recently talked about some of the focus areas for HHS here, and he particularly emphasized the Virtual Desktop Initiative, or VDI. As of now, only the Office of the Secretary has any employees at all using virtual desktops, and cost savings have already been estimated at $6 million a year, so we expect that to expand. And as that program takes hold, expect OCIO to be looking at more ways to virtualize, consolidate, or otherwise reduce the cost of the infrastructure across HHS. And now to move to some specific funded areas of opportunity for the next fiscal year. The first thing I want to talk about is CMS's quality program. And this is run out of OIS, and it's mostly responsible for creating and then maintaining the infrastructure that supports the quality improvement organizations, or QIOs. The QIO's primary area of focus are improving quality of care, protecting the integrity of the Medicare Trust Fund through fraud, waste, and abuse detection, and also addressing beneficiary complaints. If you read between the lines here, what you see is basically a collaborative platform that enables CMS and the QIOs to carry out those mission areas. This is a huge infrastructure, and their DME investment did drop a little bit this year, but they're still requesting $72.5 million to use for development activities. And between performance measurement, the fraud, waste, and abuse detection that I mentioned, and some case management capabilities, this is really the quintessential big data program. So those of you who do well in those environments would do well to seek out the quality program. There are also going to be enhancements made to the CMS help desk through this investment next year, and OIS is calling out networking tools and network management capabilities as specific requirements. Finally, with that comes network security and data protection that we're expecting to be developmental requirements in FY14.
So next is the CCIIO Healthcare Insurance Exchange. That's also known as HICS. So we mentioned earlier that CCIIO, I always want to go EIEIO at the end every time I say this. That's the group that's responsible for implementing the State Health Insurance Exchange under the Affordable Care Act. So that means that the money from HICS is going towards the front end. This is healthcare.gov here, as well as the back-end infrastructure and databases to handle the massive influx of the new data that's coming along with it. Now, I know there's been actually that big figure that's been tossed about lately, $634 million for a website. That's crazy. Why is it so high? Well, it's important to note that with healthcare.gov, they didn't just set up that front-facing website. There's also been a massive amount of infrastructure that they've had to build behind that, and that's only going to continue to grow as we go forward. So things like storage are going to be a massive requirement here in the future. And there's also more application development and web services that are going to be a part of this. Their planned focus for FY14 is on eligibility and enrollment components. And so we've got more of a data management play here, although you're also going to see a healthy requirement for the integration of systems, quality and cleanup tools. You're also going to have SOA and middleware plays here as well, because there's going to be a lot of disparate systems talking to each other in this program. So as in the quality program as well, and as with pretty much every single federal investment, cybersecurity, again, is a huge part of what they're going to have to take into account here, especially because there's so much personally identifiable information associated with this system.
Finally, moving on to a little bit of a less mission-specific program. In this case, NIH's Business System, or NBS. Now, this is it's a financial management tool running on an Oracle platform. It's part of HHS's Unified Financial Management System, or UFMS effort, which has been on the books since 2004 and is an attempt to streamline financial management functions across the optives to give better visibility at the headquarters level on financial and budgetary performance. Now, technology-wise, this is one of the areas where you're really going to be able to sell business intelligence, analytics, and some BPM tools, particularly since NIH is looking to increase its DME investment in this program by $5 million this year. Now, they're also calling out specific requirements for a new procurement management system and also planning an upgrade to the underlying Oracle R12 platform.